So welcome everyone. I don't know if you're on the call already. We're on a very new platform, the Webinar Jam, and we're all very new to it. So hopefully you've all been able to log on. And if for some reason you haven't been able to, we will be replaying this later on in a recording. So we are here with Simon Hansen, and I would like to introduce you to the Simon Hansen. So Simon worked as a teacher until 28 years ago when he became ill with a chronic condition, a health condition, multiple sclerosis. As part of his recovery, he used colour light therapy, which proved to be so successful that he was able to return to work again. So Simon is now trained in the Samassati approach to colour light therapy and has been using this therapy professionally for 13 years in McLaren Vale in South Australia. He has a particular interest in the use of light for treating chronic diseases, including MS, and Simon tells me he also uses the SE5, which is an intrinsic data field analyzer, which works to heal remotely. And I'm very curious to hear about that. I don't know about that. So welcome, Simon. Thank you so much for coming on today and presenting this webinar. And I'm going to hand it over to you.
Thank you very much, Manisha. Hi, everybody, wherever you are in the world. I was going to start this off with good evening, but that's not really appropriate. So this is a totally new medium for me also. When I used to teach children and now teach adults, I'm continually scanning the room for different expressions, responses, and at a totally different level and communicating with them. In recent weeks, wearing face masks has tried to remove that extra channel from me. So I negotiated with the participants that when they seated, they could remove their masks. And as I was reflecting on this afternoon, I suddenly thought, this is actually how a therapist works in Samassati, a communication on many levels at the same time. And I hope I can clarify that in just a minute. Your comments and questions would be much appreciated. Now, Samassati works at so many different physical and energetic levels. The way the therapist follows and is sensitive to the cues given by the client is paramount. In this presentation, I'll be attempting to take you through these levels and will be attempting to highlight each of these with a personal example. Nishant Matthews is the developer of Samassati. It's not so much a treatment of ailments, symptoms, and imbalances, but a gentle invitation to the field to discover the natural health within itself. Now, I have a book written by Anna D. Martel, which is an excellent book to actually see what other therapies there are, what are available. You will see a slide for this as well. I apologize in advance if I have misinterpreted Peter Mandel's color puncture method. I believe, from what I understand, that he had developed it around the traditional Chinese method of acupuncture reflex points. In Samassati, these are also used, but with a deeper use of energies in the application. Where in acupuncture there is a specific regime or protocol to be followed, as in acupuncture, Samassati does this also, but tries to invite a gentler way of application. Rather than doing it to someone, it is doing it with someone, reading the signs to try and find a gentler way of application and reading the person's actions and movement. Okay, so a blink here, a twitch there, a flutter of the eyelids, anything to make sure you're watching what's happening. Now, in 2008, after being trained in colour light therapy, Samassati method, I had my first experience of being a therapist. I'm not going to tell this story today. I learnt my first and most important lesson at that time from a premature baby. After my first session, I went and asked my colleague, therapist, and mentor, Lynn Dool, how do I know how long to leave the light on? She said simply, watch the baby and see what his reaction is. This was my first lesson in Samassati. I never thought a baby would be able to communicate in that way. It was at that time I learnt that to look, to watch, and to follow the client. It's very humbling. The physical body. The lights and how we react to them is the most important part of this therapy. When I see clients with injuries or following surgery, we understand that the quality or frequency of the light will have extraordinary effects on assisting with the field to bring the body to health. A fresh injury will love indigo. We believe the indigo light will calm the cellular shock that will make way for healing to begin. Emergency doctors and surgeons believe that no healing will take place for 24 to 48 hours following surgery or an accident. The indigo light shortens that time so that green can be used to encourage and equip the field, the body to heal. Old injuries require red to bring the injury to the present and then be treated with green. When we lived a life of having to survive against the things that may eat us, our body had to either heal quickly or just get on with it. Consequently, the injury turned to be a limp, an aching arm, a sore muscle, just so that we could get away from danger. I recently, a little while ago, went into hospital for some surgery. When I came out of when I was in the recovery room, my wife was there with her indigo light. It was remarkable. The doctors could not believe the rate of the healing. Things like shin splints can be treated with lights. Indigo to calm down immediately following the injury, then green. Keeping up a dialogue with the client to hear their story of the injury. If this does not work, then try using turquoise instead of indigo. And hear the story once again. Ask about the sport that they acquired the injury. There was a client who was a sprinter, and it turned out that she feared losing. So subconsciously, if she had an injury, she would have a good reason to perform poorly. At the conclusion of the treatment, she decided she needed to speak to her coach about it. Assisting the body back to health after an illness and shortening the healing time using specific protocols and changing the colors used helps support the healing. An 18-year-old suffered with depression and brought on by COVID. Everything was fine until when they went back to school, quite recently, they were told they had to wear masks. The whole experience made it very, very real to this young lad. And the stress, with the stresses, caused too much for him. During the treatment, and his mother was with him at the time, during the treatment, he began speaking about the dark thoughts he had. He spoke about his estranged father and his negativity about so many things in the boy's life. He spoke about the way he understood what his father wanted, but now that he was an adult, his father had to understand his point of view. As the treatment progressed, there was a definite change in mood in the room. He opened his eyes and voiced his love of his mother, who was also in the room, and that he would never do anything that would hurt them. He left with a smile on his face, as did his mother. Interestingly, his mother, who was present during the session, also asked for a treatment at a later date. A 22-year-old man who played recreational Australian rules football had a knee reconstruction. He saw me because he had a fear that the knee would let him down again. So we worked on that fear, treatments on the knee, as well as some of the special meridian treatments to assist with the fear and restoring confidence. In Samassati, we believe that the special meridians are deeper and require deliberate respect from the therapist. As well as the meridians, the chakras are a wonderful and gentle pathway to assist the field with old fears from childhood, as well as some cases past life, and in some cases past life and gateways to the karmic journey. A client came for treatment on her broken arm. It was the second time in 2 years that she'd injured it. During the session, she spoke of how she got it. She told me the story that she had been ballroom dancing. Even though she had never done this activity, this was her passion. During the course of a couple of treatments, it transpired that she had belonged to a sect where dancing and enjoyment were prohibited. After leaving the sect and her family, she would meet if she met a member in the street, they crossed to the other side and ignored her. Consequently, she felt guilt when she danced, when she felt fun, even though she would love it. She left knowing that she had to try to release herself from this guilt. She was going to talk with her dancing partner and knew he would support her through this time. Some examples of how the lights can assist the etheric field: releasing anger from childhood, reliving trauma that's not been dealt with, lightening the heart when releasing pain and releasing the effort to keep it quiet, beginning the healing of the spirit and attitudes born out of familial stress. When working on the etheric field with a client who suffered insomnia, she spoke of a memory and of the pain she experienced when remembering that she hadn't said goodbye to her stillborn daughter many years before. She also had a rage in her towards the midwives. In those days, it was usual for the midwives to remove the stillborn baby to reduce the mother's pain, supposedly. During the weeks that followed the session, she had dreamt about giving the baby a name, and she began the healing process. The name she had chosen was Judy. She told no one about this. However, incidentally, her son contacted her the following day. His daughter had been given a doll, and she called it Judy. The Bardo Lines The Bardo lines are often used to assist the client in regaining memories that are pertinent to their current challenges. Using the Bardo lines on the foot assisted a client with advanced cancer to recognize the guilt she felt from the way she had treated her mother when she was a child. She was jealous of her mother's relationship to her father. She felt she couldn't be forgiven. She most certainly couldn't forgive herself. Lynn and I both assisted 2 clients. One came with bruising and injuries after she fell from the rigging of a yacht. She had volunteered to go up the masthead to untangle some rigging. The wind changed and threw her against the mast. We both worked with her on the physical bruises, and in the course of this came the fears she felt. The session helped her both with the bruising and put these fears to rest. Her husband came because he felt guilty because he was in charge and should have gone himself. She was now in a better place to assist him with his guilt, since it was her idea to untangle the rigging. He came back for a separate session to be assisted with his guilt and come to terms with the responsibilities of leadership. For the purpose of this webinar, I've separated each of these bodies these fields. This is oversimplification of the human person. In reality, each of these bodies are one. When we treat a person close to the field, close to the body with the light, it encompasses all the bodies surrounding and in the space. As we move away from that body, the distance from the body is like a time filter or a movement from one field to the next. The spiritual field is what is in communion with the spirit guide, the angel, the past, the ancestor, the other, or the creator, depending on your spiritual experience. I thank you for listening to this webinar. It really is a very strange experience for me to sit here in this room and not hear anything but the ticking of a clock in the background. It's been a great experience, but very strange. Thank you.
Hi, Simon. That's fantastic. I'm not sure if the people who are listening in are familiar with Webinar Jam, but if you look on the right side of your screen, there's a little section which says chat, and I'd like to invite you all to write in any questions that you might have for Simon, and that would be fantastic. I'm sure we can drag so much more information from him, from all his great experience. I do have one question for you, Simon, and you mentioned the Bardo Meridians, I think it was, and Bardo Lines. I haven't actually heard of that before. I wondered if you could explain that a little bit, please. That would be great.
The Bardo line is on the toe, and it's on. You've got it on the left and the right, and it's a set of 8 points around the edge of the toe. Hang on, I'm doing it on my thumb. Around the outside edge of the toe. And if there's no reaction with the lights on one toe, then you move to the other. And the remarkable thing about it is that I had to do this with this particular client, and I just get blown away so often by the sorts of things that happen in that room that we have, that you don't expect. And then she started talking, and these memories started coming out. Now, I'm very careful about when dealing with memory, because I know, and we all know, that memory is a fickle thing, especially when we're talking about the memory of a child, because the memory you have is a child's memory. And we can't act on that memory, but we can act on how that memory has affected us or is affecting us now. For instance, I had, no, I won't continue with that. But yes, there's the Bardo line. It's remarkable.
Okay, and what does Bardo actually mean? What does it actually relate to? Is it the memories within the etheric field, or?
Yes, to my understanding.
Okay, and you stimulate them on the toes using certain colours.
I use
a process.
By memory, I started with red and just go through the colours, the 7 colours. So I started with red and worked my way up to the purple at the top, the violet at the top.
Excellent. I've got a question here from Sandy, and she's asking you if you could share or show us the light tools that you use.
Okay, yes. I'll be just 1 minute.
Or even maybe you could just explain what they are, unless they're very close by.
They're little. I've got 2 particular sets. One which has got specific lenses that you change over, and I've not used those for a long time. We use this other one called a. Thank you. And it's got a series of lights on it. Now, when I'm working, I've discovered when I've been working with people on their chakras, and you're doing an actual chart, not just a chakra balance, but you're actually working with memory on their chakras, I will have a feeling that they require a specific color. No, yeah, this one.
And this one too?
No. This is called a Molymed, which is what I use. And the colors are, it just goes through the simple colors. If I shine this, can you see that? Yeah?
Yes, we can.
Yellow, and there's the violet. And quite often I will use two of these. We were told that it's quite often a good idea to use two, because if your body is reacting to one, it doesn't particularly like it. In other words, it's what we call an allergy color, which doesn't mean it makes you sneeze or your eyes water, but it means that you actually need that color. So but your body is fighting against the color because it's going to bring something up the body doesn't necessarily want to deal with, and that's fine. We don't force, but using two colors, it brings about a balance. So we could use two opposite colors, red and green, for instance. And when operating with two acupuncture points, one will be needing to be calmed down, the red with green, and the other will be needing to be balanced back up, and you use the opposite color, red.
That's excellent. We've got a question here. Where can you buy the Mollimed from?
Yes, this is from a place called www.mollimed, MOLIMED, which is in Switzerland.
Excellent. Yes, if anyone wants help with that, let us know. We can forward that on to you as well. Another question, there's a couple of questions about learning about how to do the Samassati colour therapy, if you can learn to do it from home. Could you explain, are there any trainings or courses available?
It's very hard to do it from home because my wife and I, we both taught the basic light therapy sessions up in Cairns on a particular occasion. But you have to be there because it's so hands-on. You can't learn a theory of it. You have to learn an experience of it. Does that make sense?
Yes, indeed it does. And it's I guess it's quite limiting with what's happening on the planet at the moment with us being able to travel. Yeah. So has there been any adaptations for online? I know you're saying optimal is in person, or even books that might introduce the whole principle or idea for people?
Well, I know that, of course, you can get the Peter Mandel books very easily. Now, Peter Mandel, colour puncture, is very strong along the eastern seaboard of Australia. Samassati isn't as well known, except up in Cairns now, when we ran our lessons. And our teacher, Jan van der Est, he lives in Holland. He came out to Australia to teach me and a whole lot of other people here in Adelaide. And he went to Cairns also at an ALA conference, and he taught those people up there the therapist course. But of course, it makes it very difficult during COVID. Moving around is not an easy thing to do.
Would you suggest for people who are wanting to learn about the Samassati, if they're not able to do the live training, is the Peter Mandel system a good introduction to step into that?
I really can't answer that. I don't know Peter Mandel's system at all well. I would suspect no, because again, he's got his own instruments that he uses. I don't think he uses Mollimeds at all. There's another set that he has produced himself, or his company has. And yeah, I would be averse to suggesting people try and have a go because of things that might happen that you haven't planned for.
And I understand that, and it can be a very personalised experience, and if we're not there in person or the instructor's not there to really help in person, I understand the limitations.
Yes.
However, when this fiasco changes, You normally do some trainings yourself, don't you? And as you said, Jan does often come to Australia. Well, he did, and also do more advanced training in Samassati.
Absolutely, yes, that's
Yes.
right. That's right.
Excellent. I've also got another question here, and the question is, do you have specific colours for specific ailments?
There are specific protocols for specific ailments. So one protocol I used on the boy with the depression, I reversed the colours of one we call, anyway, it's for people to raise their energies, and it uses a lot of red. So I used opposite colours for him because I didn't want to. No, it uses a lot of blues, and I didn't want to highlight his depression by using blues. So I used opposite colours all the way through. But I also changed those colours, and this is the Samassati part. I changed the colours according to what I felt he needed at the time. When his conversation was lagging or slowing down, I would change the colour to one I felt was going to stimulate him better or assist him better to feel comfortable to talk. And I never pushed. I would never ask questions or probe. I simply add the light and let him do the rest. When I was treating that baby way back when, if I used light on that baby and he didn't like it, he would pull his hand away. Now, this is a prem baby. If he liked it, he would leave his hand there and I would feel his hand relax. Sometimes he would go to sleep with the light on it. And when he was ready, he would slip his hand gently out of mine. All right, I'd know it was finished. So some of these signals that we respond to are very subtle. Just as I said before, the flickering of eyelids, all right? It means that there's something going on. Or you might hear the gurgling of the stomach, which means the energy is getting through one of the meridians that goes through the person's stomach, and most do. Okay, so these are all subtle differences. Plus you can actually feel the energies on the body. So you're continually reflecting back to your hand, to yourself, what's actually happening inside the body with the light. Does that help?
Yes, it sounds like there's probably not so many pre-made specific formulas, and you're using your discretion, your knowledge, your sensory abilities to work out at the time what is required. Yes. Would I be correct in saying that?
That's right. That's right.
And Simon, something that really took my interest when you were talking about the opposite colours, using them simultaneously on the body, that interests me a lot. I've seen some quite good changes happen when there's two opposite colours used simultaneously. Can you expand on that a little bit? Maybe give us an example of where you've used that or how you use that?
Okay. With the story I told you about the lady who experienced 2 broken arms when she was a child, that started off as a chakra treatment. And as the chakra treatment started progressing, she started talking about this and talking about some of the memories that were coming to her. So I directed a separate light from, I think I was actually on the heart chakra when she started talking with green. And I started throwing a yellow light onto her abdomen to try and generate those feelings that she was feeling then. And so, and as the conversation goes, you might swap it to a turquoise on her throat, which assists her to voice what she wants to say. Does that help?
We've got a comment or a question here. Angelica's saying, is it correct to say that this type of healing that you're using, this system, is quite intuitive?
Yes. I would say absolutely. Um, yes, there's no doubt about it. My wife uses yellow lights on a child's feet to stimulate their memory. So she's a tutor as well, apart from anything else. She's a tutor, and she uses before a lesson, she will use yellow on their feet, and that stimulates their memory and their retention of the information of what they're doing. And that was another thing that came from Jan. So yeah, again, you have to read what's going on. You have to feel. You have to be present. And things just come through you. Yeah.
Excellent. Maybe that's something you can teach too, becoming the intuitive inspirer to let things come through. I do have a question here, and I know you did make the comment about Peter Mandel not being that familiar with the system, but there is a question asking about the difference between Peter Mandel's colour puncture system and, or just generally colour puncture, and the Samassati system.
All I can really say is that if Peter Mandel's system was the same as Samassati, I don't believe that Nishant would have developed the Samassati method, because Nishant developed that after Peter Mandel. Peter Mandel did a lot of work on light and the body, and how the body distributes light, and how the body accepts light and uses light as a communication form. The reason we use light on the acupuncture points is that it's already a roadway, a motorway that's been laid down within our bodies of energy. Our advantage over acupuncture is that we're not just using a needle to bombard it. We are using specific frequencies to encourage it. And I think that is probably the same as Peter Mandel. I think where we really differ, but I really can't say this for sure, and I apologize if I'm wrong, where we differ is the reading of what's happening and changing to adapt to what the client needs, rather than what I want to do to him, because it's what we do.
Excellent. There's also a question asking you what the meaning of the word Samassati is.
Oh, yes, that was right at the very beginning on the slide, which I didn't get to show you. And it means, it's from Sanskrit, and it means be a light unto yourself.
Very nice. Excellent.
Now, each of those slides and the words that they use have a quote from from Nishant Matthews on his website. And I would suggest, if you want more information about Nishant, you can go to his website, and it is, so Nishant is Nishant, Matthews, Mattthews. Just Google it, and it'll go to his address. And he talks about he also will teach this as well.
And he is the founder, the creator of Samassati therapy.
Yeah.
Excellent. There's also a question about your personal experience with treating MS, whether you treat other people, quite a few others, or educate people how to use the light for the MS condition.
I have a client with me. I have a client who came to see me years ago, and her MS was galloping out of control. Now, I do use the lights, and the lights are absolutely essential in supporting the body through the changes that are required to beat the MS. But I've also developed a regime, which I've developed through some information I got. Long story, but the regime uses three things: B12 injections, an antidepressant which floods the body with SSRIs, neurotransmitters, and an amino acid, which is just health medicine, I suppose. And those three together help control the symptoms of MS. Doesn't make you better. But what needs to happen with MS is the way the person behaves after regaining some of those things that they've lost makes all the difference to how they're going to recover and whether they stay recovered.
My internet connection's a bit poor. Can you still hear me? I think
yes, I can hear you.
Can't see me probably.
Okay.
I just wanted to ask you a little bit more about the MS. That's really interesting information. Are there any particular colours that are more suited towards treating or helping someone with MS?
With MS, we do, with the MS treatment, I have used what I was treated with by Lynn Dool in the early stages. So she would do, we do a balance, a general physical balancing, followed by either toxin clearing to clear toxins out, obviously, because MS causes them, and not on the same day, but 2 or 3 days apart in the early stages, then something to support the immune system, because of course MS is a problem with the immune system being out of control. I've added a couple of other things into that mix along the years. Now, the lady who came to see me, she had been to see her neurologist, and her neurologist was saying, listen, your MS is getting worse. We want you to bump up these medications, and told her which medications they were. And she looked them up on the internet and thought, I don't want to do this. And her mother knows Annalise and I, and she suggested, listen, why don't you go and speak to Simon and see what he can do for you? So she did. She started taking the regime of medications, coming to see me with treatments, and her MS hasn't progressed at all. She has changed her whole life around and the way she behaves. She was a young mother, and she was continually dogged about making sure the house was clean, the food was on the table on time, and if the children wanted her attention, she would ignore them and say, go away, can't do that, deal with that now, come back later. So she now stops. Food might be on the stove, she turns the stove off. She turns around and she talks with her children. It just has to happen that way.
Can you tell us a little bit, what would be a typical protocol, for example, someone with a chronic condition like MS, how often and for what sort of span of time would you be wanting to see that person for effective treatment?
Well, this particular lady, she just keeps wanting to come back because she finds that when she can sit and chat with me, or when we talk about things, I will pick up on things like, oh gosh, it's been such a busy day, I've done this and this and this. I said, now, is that a good idea? If it's a busy day, what's that going to tell you about your MS? Oh, she said, I did feel really exhausted. There you are. What's that trying to tell you? Pull back, stop, smell the roses, go for a walk on the beach. But don't get back up on that wagon that threw you off in the first place.
Would you be seeing them maybe once a week for a few months?
Yeah. I see her every 2 weeks for about 45 minutes, half an hour, 45 minutes. And because I'm seeing her so regularly, I don't charge her as much as I would charge somebody who's only coming for a short time, because I know where I'm going much easier with it. And I just have to listen to the language she uses and watch her reactions to the lights.
Excellent. I've got a question here. I'll just see if I can read it. Could you please explain further the use of violet or indigo light for healing injuries, and how long would you apply the light, and how often, and how much does it increase healing by?
Okay. Well, going back to my own experience of receiving the light from Annalise, yeah, I had quite an extensive scar from the operation, and she treated me on the scar. Now it was wrapped up, but that doesn't matter because it's energetic, and we're talking about energy, so it's in a field. It doesn't have to necessarily be on the body. So I've heard stories, for instance, when frontline doctors in the Desert Storm heard that indigo light's great for stopping bleeding, they would cut the patient open and direct an indigo light in there. Well, that's sort of a bit counterproductive, really. So, but we're saying that that you just need to place the light around it, and that's all. The body does the rest. Now, for those doctors who came and changed my dressings 2 days after the operation, they could already see that the knitting had started, the joining of the skin had started, and they were blown away because this is unheard of. And fantastic. They said, what have you done? What have you done? And my wife had to be there. She said, I put some blue light on it, indigo light on it. And they said, what?
What's a typical length of time that you would apply that light for in a sitting?
Just however long you feel is right. All right. Now, in her case, I wasn't conscious, so she wouldn't have seen any movements in me. But however long she felt, it was correct. As she was applying it, she would have felt a reflection coming off of the energy that would come off. So for me, what I do is I apply the light like this, and this hand is placed in a reflective sort of mode. So I will feel the energy happening as I'm moving. Once the energy starts to diminish, they've had enough.
Beautiful. Very intuitive and live response feedback, which is wonderful.
Yes.
There's a question: how much do you charge for a colour therapy session? What is the duration? I think you said it's about 45 minutes typically. Is that correct?
Yeah. A first session might go for longer because there's a lot more chatting at the beginning as we try to tune into each other. So probably about an hour for a first session, 45 minutes for ensuing sessions, and I would charge $80.
Excellent. Now we've just got another question coming in. Is it helpful for internal inflammation, such as reflux? And what about the penetration? I think there's a bit of spelling there. Penetration into the body. So, okay, I think the question's meaning, can you use it for inflammation, which is deeper inside the body, and penetration distance into the body? Okay, how far does it actually penetrate the light?
Right. Well, because we're not talking about just physical issues. If it was just physical, I would say, yes, you probably got to use a stronger light, but it's not. And this light isn't strong. It's not a laser. It's just a little LED. Okay? And so that's not necessary to worry about how deep it goes. The body will take it where it needs to go. There's another light system where they use the syntonic optometry, and the light just goes into the eyes. Okay? And the body takes it where it needs to go. Depending on what the story is behind the reflux would also depend upon how I would treat it. I would find out where that's coming from. Where's the stress being caused that's causing this reflux? What else is happening there? So I'd need to know a lot more about it than just what light to put on it. Yeah, it's impossible to answer that question without more information.
Sure. And there's another question. How long did it take you to become intuitive with your client's reaction? And then I assume after learning Samassati that this connection with clients might take a while.
Absolutely. It's I was very lucky. When Lynn was treating me in the early days, I was able to voice what I was feeling. I could feel when she placed it on my back in one particular point during a balancing, it felt like I could feel like a draft or a cold draft on my back in that point. And she was fascinated by this because I was the first client she'd had who could voice this stuff. And so I was very lucky in that respect. I guess I've also been fairly intuitive because as a teacher, when I was teaching primary school, I would be able to tune in to what that child was thinking or what they were feeling just by the expression and the way they reacted to my voice or somebody else's voice in the classroom. And I still do that now when I'm teaching adults. But I guess the first time I experienced that was when I treated that little preemie baby, my first client. It took me a while to get my confidence with it, but I was feeling something then. My aunt also taught me how to use crystals many, many years ago, 35 years ago. And so through the crystals, I've actually learned how to feel the energy. Yeah.
Excellent. That could be a very valuable course to do in itself, just a mini training on how to develop our intuitive abilities for healing.
And feeling.
Very good.
Yeah.
So there's a question from Andre. Can you do remote sessions? And that actually taps into also what I read in your bio. But yeah, do you do remote sessions? That's a very good question.
I do. Now the IDF, the intrinsic data analyzer, it's actually a quantum machine. And during this time of COVID, I've been doing a lot of work with it because COVID has caused a lot of stress all around the world. There's a lady I treated who comes from South Africa, and she's working far northern Australia, in a small community up there as a nurse. And she said, in South Africa, she's got her family. She's here in Australia to earn the money to send back to them because there's no way they can go and get work. She's lost her father, she's lost her grandfather, and her mother and the children are sick at the moment with COVID. So she's suffering from all this stress. She's got physical problems with her ankle and her hand. And she got in touch with me and said, look, can you help me with this? I'm just overwhelmed. And so I did a diagnostic run on the SE5 and discovered all these things that were out of balance. And the SE5 is able to then send a treatment to her to try and balance those up again. Now, it's a little bit like, do you have to be a mechanic to drive a car? The answer is no. And do I know how exactly the SE5 works? Well, the answer is no, but I know how to drive it. Another time, my aunt said to me, when she was entering her final stages, was really depressed about life and being such a waste of space and that sort of thing. So I sent her a treatment to help her with that. And she phoned me back the next day and she said, Simon, did you send me a treatment to help my mood? I said, yes, I did. Do you feel better? She said, I feel great, but just answer me this. Is this machine going to make me live longer? I said, no. Good. Then you can do it again.
Oh, dear. Can you explain what that machine actually is? Is it a computerized...
Yeah. The machine
maybe just briefly, because
the machine
an idea.
Works through a computer program, and it has a pad on it where I react with the machine, or the machine reacts with me, and we work together. And as I go through the diagnostics, we're looking at specific frequencies for a specific part of the body. So, for instance, if we're talking about bad memories and where that might be stored, then I will feel where it is in the body through the frequency that we're testing at this particular stage. And every part of the body, cells, muscles, tendons, in the knee, in the elbow, doesn't matter. They all have their own frequency. And if I'm testing that frequency and it's coming up short, then we know there's an imbalance. And the machine will send the correct balancing frequency to it. Okay, does that make sense?
Yes, and
how it does it, as I say, is quantum. So I don't thoroughly understand, but how it was explained to me is that it uses a double sine wave. Now, a sine wave is a curly line like that and quite smooth. And if you put another one up against it, you end up with a straight line. But along both of those sine waves, they both carry specific data, in this case, vibration, not felt by anybody. And it can go through the earth. I would send treatments to a lady in California who was having problems with breast cancer. And she said she'd felt it coming back and was seeing her doctor, oncologist, later. And so I did a diagnostic for her and I sent her a treatment. And she said she came back from the oncologist, she'd had a scan and the cancer's gone. I don't know if that was me. It might just have been pure coincidence. I just don't know. But
that's fantastic. Can I just ask you about remote sessions? Do you require a photograph, their name, or part of their hair, or anything like that, or what's required?
I was using a piece of hair. That's what I was told originally, because it uses the DNA to target. But Jan told me, don't use the hair. You don't need it. And apart from the hairs, no one should handle anybody else's DNA. So I said, okay, what do we do then? He said, just use the photograph and focus on it. And so I do that, and that's enough. So I also get their name. I don't really need their address. So I do need their name and where they live, phone number, email address, that sort of stuff. So I can
just stretching that a little bit for people who use colour therapy, do you think it could be feasible to use colour therapy on a photograph of somebody to affect them remotely?
Absolutely, Manisha. Yes.
Excellent.
That's all built into it too. So it looks at the color quality in different places. It looks at the energy in different places. So yes, it uses all of that.
Okay, that's wonderful. I've got one more question here, and then we might wrap it up. And it's a question about, is there any specific methods or whatever you can comment about ADHD, treatment for that?
Yes, there are, but off the top of my head, I can't tell you what they are. Okay. But yes, there are. For instance, one lad I was actually treating his sister, and this little boy was bouncing all around the room. And I said to his mum, I said, would you like to pick him up for a minute? So she picked him up. I used indigo on the base of his skull here, the back of his head, and he went calm, absolutely calm, stopped wriggling, stopped jumping. And then I finished my conversation with the mother or the daughter or whatever it was. And she said, oh, thank you so much. And what did you do to him? She said, can I have that light? Took the light away, he was bubbling away again. So, yeah.
Oh, that's very interesting. Just quickly also, do you most often use the light tool that you're using directly on the skin, or are you normally using it just a little bit further away from the skin?
They're both. The more physical the problem, the closer to the body I'll be. In Europe, where Jan works, he gets his clients to strip down to their underwear. I don't do that here. It's not in our culture, apart from anything else. So what I get the client to do is, if they're in dark clothing or jeans or something too thick that the light can't penetrate, I have some white smock things that I get them to wear, trousers and a top, just so that I could get the light through to the body. Yeah. You
shine the light through that smock or underneath them?
No, okay. through the cloth, because it's just t-shirting material and it's white.
Excellent. So are there any final tips or comments that you could give to somebody who's new to this field and wanting to explore and go on a venture into it? Anything wise tips?
For me, the light therapy has been an absolute education. It's taught me to listen. It's taught me to read people. It's taught me to adapt to what they want and not what my brain thinks I think they want, or what the book tells me that they want. The SE5 has done exactly the same thing, but the SE5 seems to be an extension of my own body as well. Again, that's another long story, but yeah. At this stage of COVID, I've done a lot more remote healing than I have anything with lights. And the results have been absolutely remarkable. Unbelievable.
That's very encouraging. Very, very encouraging. I hope everyone who's listening to this takes that on, because that's such a powerful tool that we can use in this time. We need it.
Absolutely, absolutely. And it's been it's been a challenge for me to actually work out, because when you're dealing with something like fear, or you're dealing with something like grief, it's not tangible. It's more than just it's more than just something that's out of sync. It's your whole being that is crying, and that needs attention.
That would be a fantastic topic to explore within itself. What could be done with light, with your specific system, to help people in fear, because I think this pandemic is that's its character, really. It's fear-based. So it's just wonderful hearing you speak about this and what you can do to help everyone. So thank you so much, Simon. You've been wonderful sharing your knowledge.
Thank you so much.
We will make this recording available for everyone afterwards if you want to go through some of those quotes or the websites that I mentioned. And thank you so much, everyone. We will have also again another ALA free webinar in October. We'll keep you informed and updated about that. So thanks everyone, and thank you, Simon.
Thank you very much, Manisha.
All the best.
You too.
Bye for now.
Bye.